Hey guys, it's Jamie. Welcome back to my channel. In today's video, I kind of wanted to go over what like a first trimester scan would look like without being able to post any pictures. I mean, I can try to insert some, but I wanted to just kind of explain it to you because I've gotten a lot of questions to kind of go more in depth on what we do. So, without further ado, I'm gonna hop on into this video. Okay, so first and foremost, I wanted to let y'all know, so Thursday was my last day of training in the MFM clinic. I am now a full-time MFM sonographer at the same clinic, so I'm still there, but I finished my training, and let me tell you, it was such a relief to be finished. However, Monday, tomorrow, is my first day on my own, and I'm scared. I'm very nervous. I mean, don't get me wrong, like all the girls that I work with, they are amazing, and I'm sure they're gonna help me if I need any help, but it's just so nerve-wracking because there's certain exams like the fetal echo that I'm still like not 100% confident in. Yes, I know how to get to the fetal heart views, I know what I need to do for the fetal echo, but every pregnancy is different, and it all kind of depends on how the baby's laying or the mother's maternal body or the mother's body habitus. I mean, if a person has a high BMI, of course it's going to be a lot more work for the ultrasound machine and for the sonographer to be able to see the baby. So with that being said, like, we're also going through many obstacles such as baby's positioning, like I was saying, baby positioning, mother's body habitus. Different ethnicities have more dense skin. You know, there's a number of factors that play into it. So when I get the question asked, because I get this question asked a ton, is physics involved? Every day. Absolutely. No, and not in the sense that like you don't really have to worry about numbers, but you need to know what adjustments to make on the machine in order to optimize your picture. So yes, physics is definitely something that I use every day in ultrasound. But after repetition and doing it over and over and over again, you kind of already know, like, it becomes second nature to just what settings to change. But let's go ahead and hop in onto this video, and then maybe tomorrow I'll record a video, or maybe I'll do like my first week. I'm not sure, but I'll definitely keep y'all up to date how I'm doing on my own. But this video today, like I was saying, is going to be a first trimester scan, and I'm going to do my best to edit some pictures into this video so you can kind of get a understanding of what I'm talking about. So I'll just Google some images and post them on here. So when we get a new patient about 12 weeks, and that's the gestational age of like 12 weeks, where we do what's called a Nuchal Translucency scan. So the mother comes in, and basically we get the baby into a sagittal picture, or not sagittal, yeah, profile. We get a baby into a sagittal profile picture. We have to zoom in on the baby to make sure the nasal bone is present, and it should look like this. I'm gonna try to insert a picture right here somewhere on the screen, but it should look like that. And then the Nuchal Translucency is we're going to be measuring the back of baby's neck, and I'll try to insert a picture of that as well. But we're going to measure the distance between like the fluid behind baby's neck. So when I first go into a room for a patient, I always check to make sure that I am indeed scanning the correct patient. I have the patient verify their information. So there's two ways that I check these, and that's basically when I first get their chart, I look over their chart, I see all the patient's information and their history. Then when I go into the patient's room, I ask their name. Then I pull it up on the screen and I ask if all their information on the screen is correct, which then again verifies their name and date of birth as well. It is very important because you never want to do a scan on the wrong patient. That goes with anything because it can be considered assault. I know. kind of scary, but it's true. So always verify that you have the correct patient. Then, once I verify that I have the correct patient, I explain to the patient what I'm going to be doing. And I try to give them as much information as possible, because you will learn, if you're in the medical field or if you're in ultrasound, you'll learn that no matter how much you explain to them, they're still going to ask the same question that you already explained to them. For instance, when I tell patients that they're coming in for a BPP, I let them know, hey, this is what we're doing. We're doing a BPP. All we're going to be looking at is the amount of the amniotic fluid, baby's heartbeat, make sure baby's practice breathing and moving. Nowhere in there do I tell them that we're gonna be checking their weight. And yet, it never fails. Almost everybody will ask, can you tell me how much baby weighs? Not on this exam today, I'm sorry, but your next exam should be a growth scan and they'll be able to tell you that. So, with that being said, I go ahead, explain the exam. An NT first trimester exam should take approximately about 30 minutes. It can be less, it can be more. It all depends on how well the baby is cooperating. That's what we like to say. Babies never really cooperate 100%, and most of these exams are on their terms. So, I go in, I let the patient know, I put the drapes on the patient so that I don't get gel on their clothing, and then I take gel and I add it onto their abdomen. Then I start to scan. On these scans, my protocol is I look at the uterus. I do it in a sagittal plane, so I'm looking at it long, and then I turn transverse on it and I look at it sideways and I make sure I have both pictures and both are seen with an intrauterine pregnancy. Okay, after I do that, on these exams you always want to do your crown rump length on the baby first. So you measure from the top of baby's head to their bottom. That should give you the most accurate, in this time frame, accurate gestational age. And if baby is between 45 millimeters and 84 millimeters, then yes, we'll go ahead and do the nuchal translucency measurement. Okay, it is not necessary to do the nuchal translucence. I can't talk today. It's not necessary to do the NT, but it gives us a good it's a good indicator on whether or not the baby has neural tube defects, like trisomy 21 Down syndrome. So it definitely gives us a soft marker for that. So that's what we do those for, because we can monitor for any other soft markers or hard markers, and so that's why we do the NT scan. So once we have the crown rump length, and let's assume that the baby is in range to go ahead and do the NT scan, I then go ahead and I'll come back to the baby. I let the patient know, all right, so now I'm gonna go look at your ovaries, and then I'm gonna come back to baby. So I go out to their right side, find their ovary, and I measure in long and in transverse. And I'll also take a picture of their right adnexa. Then I go to their left side and I'll find their left ovary, measure it long and transverse, and then I will take a picture of the left adnexa. And if you're unsure of what adnexas are, it's the outsides of the uterus. It's on your right and left side. It's on your flanks. So we're basically making sure that there's no growths out there growing, tumors, fibroids, anything like that. And we're also making sure that there's no free fluid, because that can be an indication of a ectopic pregnancy. So after we do that, now we're gonna work our way back to baby. I like to go ahead and get the baby's heartbeat. So when I go get the baby's heartbeat, I zoom in on the flicker, because you'll see it flickering on the baby, on the fetus. You'll zoom in on it, and then you'll use your M mode. You'll put your M mode on there, on baby's heart, and you get the waveforms, and they're like this. It shows the contractibility of the heart, and then you'll measure to find out the heart rate. And so I'll see if I can put a picture on here. I'm not quite sure I will, but basically there's going to be little humps where the heartbeat is, and you measure one at the beginning of the hump or wherever you want to do, and then the next beginning of the hump you don't put it there, but the second beginning of the hump you'll put it there, and it will tell you the baby's heart rate. Okay. I hope I can find a picture to put there. So once I get the heart rate, I then now go and do a sweep through again of the uterus, and I look at where the placenta is at. Okay. Sometimes in these early pregnancies, it's a little hard to tell where the placenta is at, whether it's anterior, posterior, or right lateral, left lateral. It can be pretty difficult to tell sometimes. So what I do is I'll put color on where I think the umbilical cord is, or over by the placenta, and I'll look for the placental cord insertion, and that's a good indicator of where your placenta's at. So I'll say anterior placenta or posterior placenta, PCI, which is placental cord insertion. Okay, once I do that, then I go and I look at baby. Now, you want to get baby in the same profile picture as when you were doing the crown rump length. I honestly say if you do that crown rump length and that baby's being still and it's measuring within range, if you can get a good NT at the very beginning of the scan, do it. Because I promise you that baby is not gonna always be in that position. So if you can get it when you do that crown rump length, get it. Because you want that baby to be in that perfect profile picture, and you wanna see that nasal bone. And you also wanna see the space between baby's neck, okay? You also want to make sure that you're not measuring amnion, because sometimes the babies lay on that amnion and you cannot tell where the back of the neck is versus the amnion, and so you can kind of give a wrong measurement. So you definitely want to make sure. And one way to do that is sometimes to have the mother cough. So I'll ask them to cough, and that baby will kind of bounce up from that amnion most of the time, and you can measure that area, okay? So you'll take like 3 measurements of the NT. Once you get that, then you can start looking at the baby to do a basic anatomy. And basic anatomy, yes, you can see fingers and toes and so on and so forth, but some views are not going to be able to be seen quite well. It's way too early to tell gender at this time. It's too early to look at the heart really. So what you're going to do is you're going to start at baby's head, and you're going to see the choroid plexus. You're going to be looking like a transverse view. So you're going to see the baby's head kind of like just a circle. Okay. You're going to see the choroid plexus on both sides of the hemispheres and baby's brain. You're going to take a picture. Then you're going to go down to baby's torso, and you're going to put color on the heart. I like to split my screen, so I have one with the color of the heart, okay? And then I like to go down a little bit more, and on the other screen I like to put the stomach. This shows the situs of the baby, how the baby's laying, the fetal lie, okay? And it also shows that the stomach and the heart are on the correct side, which is the left side. If it's not, then you're gonna have to look for other issues going on with the baby, like situs inversus, stuff like that. So I like to do that. Take a picture proving that the stomach and the heart are both on the left side of the fetal chest and abdomen, okay? Then after I take that picture, I like to put a little bit of, I like to put color on the heart and kind of do a sweep through the heart to just show that there are those crossovers there, and that you can see as you come down, there's the fetal stomach as well. I don't think that you have to do that, but I like to. My preceptors, both of them, do the same thing, so it's kind of something that will stick with me for forever. After I get that, then I like to go down to baby's bladder. I take a picture of baby's bladder and make sure baby's got a 3-vessel cord. Then I also take a picture of the abdominal cord insertion. So you want to have the circle with the cord coming off, and showing, putting color on it and showing that there is blood flow through that umbilical cord into baby's abdomen, okay? Then I like to take a picture of baby's legs, make sure baby has both legs. You want the feet, legs, and everything to be in the picture. They look like little frog legs to me, so that's what I call it. And then you go and make sure baby's got both arms and both hands, and you can see their fingers. You're not going to necessarily count them on this exam, because when they come back, they're going to do their detailed anatomy scan, and at that time they will count fingers and toes and so on and so forth. Okay, so after I've done all that, I like to do a quick sweep of baby, just kind of showing everything as I go through. And then that is the end of the exam. It's the easiest exam there is. When I first started doing it though, I could not get baby in the profile view if my life depended on it. I mean, somebody could be in there holding me hostage and I would they're gonna have to kill me because I can't do it. No, but for real, it's really hard at first, but once you get it, you're just like, you can't get rid of it. It's always there. So what I've learned through my training is sometimes you have to go high up on mother and angle down towards that fetus to get it in that nice profile view, or you come really low and angle up to get that nice profile view. And you need to check all areas, because if you stay in one spot, you might never get that perfect profile. I'm sorry, excuse me. So definitely move around and use, you know, your angling techniques to get that perfect position. Like I said, this is one of the easiest exams there are to do besides the BPPs. But I'll go over those on another video. But yeah, if you will, I do post things on sonography, lifestyle, and everything on my Instagram. So if you go ahead and go to JME Cadena, that's my Instagram, and just go in there and follow me, and that way I can post some things and you can see what I'm doing there. So yeah, thank you guys for your love and support. Sorry, I hope I didn't ramble on this video. I kind of feel like every video that I do, I ramble a little bit. Even though I make notes, I'm still kind of like, but that's okay. I'm gonna get better at this one day. One day. But thank you all for your love and support. I hope you like this video, and I will be back for another video very soon. Love you guys.